Hi, I'm here with Teresa Kieser, and I just found out that you're working in Kenya, doing amazing work in Kenya.
Well, thank you, Lorraine. Actually, it's not just me, it's our wonderful foundation, the Kibos International Health Foundation. Was started by Ambrose Kibos, who is an electrophysiology cardiologist born in Kenya. And our mission is to incept sustainable, maintainable cardiac surgery, adult, pediatric, valve bypass for the Kenyan people, but by the Kenyan people. We don't want to just fly in and fly out with teams of surgeons. We want to start from the ground up. It's a lot of work to do. They have excellent cardiology right now. We did a clinic seeing more than 50 patients. My colleagues, Professor Hiroshi Niinami from Tokyo Women's, Dr. Yuki Ishihara also, and Dr. Nakao Kazu, and we melded as a team, and it was just absolutely wonderful. The Kenyan people are beautiful people. They wear their hearts on the sleeves. They really do. You look at them, they smile, or you smile at them, and they suddenly beam. So, but there's so much needed. There's so much needed. They do not have a cath lab in Kenya, so there's no coronary surgery. I don't think there's any pediatrics.
Send them
Oh,
over.
yes, they send them to India.
Wow.
The coronary bypass patients go to India. So,
And for the cat?
there's no cath. They
For
do,
the cath,
they do
send them
valve surgery.
to
They do valve surgery,
India?
but without they don't do caths at all. They for valve surgery they do echoes, and they don't do catheterization. There's no, I don't think there's any pediatric except maybe people flying in, flying out from their teams, but nothing done by the Kenyan people. So there are surgeons there that are trained, but there needs to be a full spectrum of cardiac care. So it's starting from the ground up, but we are so enthused after our recent visit. We were there September 11th to 16th with a big team from the Kibos Foundation, and there we have a memorandum of understanding with His Honorable Governor Paul Simba Arati, and the Nwancha Hospital in Kieser County, the Kieser University, and the Kibos Foundation. So we have now started the process. And we couldn't do anything before this because of COVID. Our first meeting was May 1st, 2020, right at the beginning of COVID. So now we're on a mission to get funding to help the Kenyan people. Our mantra is no Kenyan should go to heaven before their time.
So beautiful. So exactly what are you doing right now when you go there? Tell me
Well,
a
we've
little
only
bit.
been once, so now our next visit will be in May, and we're really hoping to be able to get some heart-lung machines, and maybe not a cath lab yet. That's going to take about a year, but to do valve surgery. Actually, pediatric surgery will be first, because for pediatric surgery you just need echo. So our stepwise process will be pediatric surgery with Dr. Nakao Kazu. Then we'll go to probably valve surgery, and then hopefully we'll have a cath lab in about a year, and we'll do some bypass. Yeah, I know, it's what I live for. I'm just kidding.
So to get the cath lab and working there and make all the what you need to
Yes,
be,
and train
because cardiac
people.
surgery is
It's huge.
you need a lot of things. You need a place, you need an infrastructure.
We have place. We don't have the machines, but we have
Infrastructure.
Yeah.
So to do that, you are needing funds, right?
Oh yes.
How are you doing that?
Step by step, piano, as they say in Italian. I'm going to be canvassing industry, the societies, just anybody who will listen. As they say in the Bible, let anyone with ears listen.
So do you want to invite someone to fund? Yeah, you have the camera for you. Come on.
Thank you. Yes, well, we would greatly the Kenyan people would greatly appreciate if we would have donations to the Kibos website, because we are paying our own way to go now. We have nothing, and but it's the longest journey begins with the first step, and please be our first steps. God bless you all.